Hi, morning. Mr. CK, I'm
Yes.
Dr. Law here.
Hi.
I'd like to examine your knee today. Is that
sure,
all right?
Sure.
Okay,
Sure.
all right.
Sure.
Now I'm going to use an alcohol rub before examining the patient. Mr. CK, I get you to lie down on the bed.
Okay,
Yeah.
sure.
At the end of the bed, look at the knees and the legs for loss of normal alignment of the legs and loss of normal symmetry, and look for leg length discrepancy. Now move forward and look at the knees for scars, swellings, muscle wasting of the vastus medialis, fixed flexion deformity, and again valgus and varus deformity. Now we proceed by feeling the temperature of the knees, starting from the mid-thigh down to the knees, and compare the temperature between both knees. Now feel for patellar tenderness, both knees, and flex the knee to feel for popliteal swelling or cyst behind the knee. To assess for effusion of the knee, we can press the suprapatellar pouch vertically downward and perform a patellar tap. Now we can perform a cross fluctuation or a bulge test by compressing on the suprapatellar pouch and empty the fluid from the medial gutter, sweep it across the suprapatellar pouch and down the lateral gutter, and you can see the filling of fluid on the medial gutter. Now I get you to flex your knee and palpate for the joint line and the patellar insertion, and feel for the medial collateral ligaments as well as the lateral collateral ligaments. Now I get you to move your knee, to flex your knee all the way in and extend the knee. And I will do it for you passively. Just relax. You to flex your knee again. Look at the knee for posterior sac laterally. If there is posterior sac, it may represent posterior cruciate ligament damage. As an alternative test to look for the posterior sac, we can get the patient to lift up the leg and relax and support at the ankle and flex the knee at 90 degrees and observe for the posterior sac against the gravity. I'm going to perform a anterior draw test by stabilizing the knee at 90 degrees with the forearm and placing your hands at the popliteal fossa and the thumbs over the tibia and do a drawer test. And by doing that, if there is excessive anterior movements, it may represent anterior cruciate ligament damage. I go on to perform a collateral ligament test by flexing the knee at 15 degrees and pushing the collateral ligaments laterally and medially to check for collateral ligaments damage. Now we get the patient to stand and again look for any deformity of the knees, mainly the valgus and varus deformity. We get the patient to turn around to look for popliteal cyst or popliteal swelling of the knees. Now we get the patient to walk to look for abnormal gait